This is Conversations with Chanda. In this episode, we are talking to Dr. Marc Gorelick, the CEO and president of Children's Minnesota. In October 19, 1988, the following letter to the editor appeared in the Washington Post. With the campaign against Maryland's gun control law in full swing, one large interest group is notable for its silence: our children. The danger of handguns to children should be self-evident, but the following facts may serve to reinforce the obvious. Firearms are second only to motor vehicles in causing incidental fatalities among children and adolescents. Many of these deaths are attributable to guns in the home. A recent study found that a household gun meant to protect the family is actually 18 times more likely to kill a family member than an intruder. Carelessness is responsible for a large number of these cases, especially among children. According to a Houston survey, 10% of families reported that their guns were always loaded, unlocked, and within the reach of a child. Easy accessibility of guns is also a major contributor to the shocking epidemic of teenage suicides, currently the third leading cause of death in that age group. More than 2/3 of childhood suicides involve guns. Children cannot lobby, so it remains for those of us who must treat their injuries to make the case for them. Children also cannot vote. Fortunately, their parent can. Stay tuned, and I will see you on the other side.
You're listening to Conversations with Chanda, a podcast that unpacks the community's grittiest, most vexing problems, hosted by Chanda Smith Baker.
Marc, welcome to Conversations with Chanda. I'm so pleased to have you with us.
Thank you. It is really a delight to be here with you.
Yeah, so, I've had the opportunity to run into you at many community events, and I have the pleasure of knowing many folks that work for you. And so I feel like I have layers of understanding of who you are, but the audience doesn't know who you are. So I would love it if you could take a second, introduce yourself, and say a little bit about what you do.
Yeah, well, thank you. My name is Marc Gorelick. My pronouns are he, him, and I'm the CEO of Children's Minnesota, which, for your listeners who don't know about us, we're a children's health system located here in the Twin Cities. We have 2 hospitals, one in Minneapolis, one in St. Paul. We're one of the 10 largest children's health systems in the United States. We serve kids from the entire metro area and throughout the state. And I've been here for 7 years now. But my background is as a pediatrician. I'm a pediatric emergency physician, so I've always been in children's healthcare for more years than it probably looks like, about 35 years now, and in different parts of the country. But it's something I care deeply about and passionately about is the health and well-being of kids.
My daughter, Elan, she's 25 now. I keep saying I've been in the work for 25 years, Marc. It's been a little bit longer than that, but I'm staying at 25 for a while. But I think I shared with you that she started out a little rough in life and had about 9 surgeries before she was 2. And the one thing that I am beginning to understand more and more about healthcare is the more proximate you are to it, the more you are into what is happening around wellness and care.
Yeah. I mean, health is much more than just healthcare, as we know. And, at Children's Minnesota, we're primarily about providing healthcare. That's what we do. But we also have a role in doing the other things that are required to make sure that kids grow up healthy. And that means paying attention to all those other social factors that influence whether or not a child is healthy and grows into a healthy adult.
Right. The story that I tell people when I share this story is not just what Children's did for my daughter, but the care that they took for me, because it's a very scary thing to not be able to control the outcome for your children. And I was handled so gently and carefully as I was trucking along this very unfamiliar path. And so Children's will always be very close to me, but it recognizes for me the importance of who you have in healthcare and the level of concern that they bring every day.
Yeah. One of the unique things about being in children's healthcare, kids are never alone. There's just they're always part of a unit. Parents, siblings, that whole family, and it is care for the whole family. Because again, we do what we do, but at the end of the day, that child's health is determined by how well their family is able to help that child, in addition to what we do. And it's something we do take very seriously.
Yeah. So, Marc, you did not start out 35 years ago as the CEO of a hospital. You started out as a doctor in emergency rooms, or what was your journey?
Yeah. I did my training in pediatrics, and then I subspecialized in pediatric emergency care. And I practiced that for about 25 years before I moved into full-time leadership roles.
As part of your journey, as you started out, you began to notice the number of children coming in that were impacted by gun violence.
Mm-hmm.
It is a concern, but you have seen it up front and personal. How has that impacted you?
Yeah, I did my pediatric training in Washington, D.C. in the mid 1980s. And, it was a time when I think in a lot of parts of the country, but especially there, gun violence was a huge issue. And, I've seen thousands of kids in my career, but the ones that really have a particular impact for whatever reason are those kids who have been injured by guns, in some cases shot by others, in some cases shooting themselves. In part because I just know it doesn't have to happen. I mean, those are things that we can prevent. And so they really do stand out. And my interest in this, going all the way back, as you said, I mean, I was advocating about this early in my career when not sure why I thought anybody cared what I had to say, but I wanted to say it. Yeah. It is because of what I have seen and what I have experienced.
The thing that you said that there's a lot that you said that stands out, but one is children that injure themselves. Mm-hmm. Because often when we talk about the gun epidemic, for those of us that don't have proximity, we think about it in terms of an urban street violence issue, and we fail to think about it around domestic issues or around suicide.
Absolutely.
How prevalent is that?
If you look at all people, adults and kids, almost half of the gun deaths are actually suicides. For kids, it's about 40%. So it's rather shocking. And you're right. When we hear about it or think about it all, the school shootings get a lot of press, and they're horrible. But that's not where the big problem is. It's kids shooting kids. It's kids shooting themselves, whether intentionally or unintentionally. And again, it doesn't have to happen. Yeah.
You have a book.
Mm-hmm. Just came out. Yeah.
Saving Our Children, that sort of details your learnings and then opportunities for us to address this crisis. So I assume that you being connected to this issue in such an intimate and concerning way has led you to putting this out. What is your hope from it, and what could you share about the book?
Yeah. As I said, I mean, this is something that I have cared about for quite a long time. A couple of years ago, in 2020, guns became the leading cause of death in children in the United States. And that got a lot of attention. Now, I'm glad it got attention. If we're being honest, it's been the leading cause of death for Black children since like 1999. Okay, so there's another example of some of the inequities in our society. But it got a lot of attention, and there were people that were calling it a public health crisis. We had other hospitals in the Twin Cities. We got together and put out statements saying it was a public health crisis. The Surgeon General recently called it that. And I thought to myself, okay, we're saying that, but we're not acting like it's a public health crisis. There's a disconnect here. And it's not because we don't know how to deal with a public health crisis. When COVID-19 hit, we acted like we were in the middle of a public health crisis. So I started to think about what would it look like if we actually walked the walk and we said, we actually acted like gun violence, particularly affecting children, was the public health crisis we keep saying it is. And that was really the impetus for this book, was to paint that picture. What does a public health approach to gun violence look like? What does that mean? And how can I inspire others who care about this, particularly my colleagues in the healthcare community, to say, yeah, we can't just say it's a public health crisis. We need to act that way.
Do you have some examples of what acting that way would look like?
Yeah, I think, one of the cornerstones of public health, and I have a degree in clinical epidemiology, so I've studied this a little bit. One of the cornerstones of public health is recognizing that public health problems are always multifaceted. It's not a thing. I mean, even COVID-19, it wasn't just about a virus. There's always a model that includes, there's factors about the thing, the virus, the gun, the bullet, but there's also factors about the individual, behavioral factors. There are social and infrastructure factors, and you can't isolate those. So that's premise number one, is that we have to look at it holistically. And the solutions are always going to be a mix of, on the one hand, education, getting people to change what they do, and policies. And policies means advocating for those policies. And so another thing I would like to see is more of my colleagues who all know this is a problem. I mean, this isn't a secret. I didn't just wake up one morning and say, oh my gosh, guns are killing kids. I mean, everybody knows this. Would actually use their voice to advocate for the things that research shows actually reduce deaths.
You pointed out that recently it has been named the number one reason for childhood deaths, but that it has been number one for Black children since the late 90s.
Mm-hmm.
How much does race and classism factor into the lack of attention to this issue?
Yeah, I do think that's part of it. You said it earlier. If the portrayal in the media is that this is somehow an urban problem that affects those people, in quotes, it can be hard to get attention. And the fact is, it affects everybody. Kids die by gun violence in every congressional district in this country, in every state, in every community. And it is something that, the other thing I always want people to understand is, if you wonder about whether this is relevant to you, to your community, to your practice, the answer is yes, it is. Rural communities, urban communities. In fact, the rural communities per capita have a higher death rate from guns than urban communities. Mm-hmm. Something a lot of people aren't aware of. And so I do think that the fact that it does disproportionately affect underrepresented communities like the Native American community, the Black community, is certainly a factor in it not getting the attention it deserves. We see that over and over again in healthcare, that the fact, things that disproportionately affect those communities don't get the attention and the response and the funding. I think that's certainly a factor here. And again, part of that public health approach is understanding what is it that is contributing to that disproportionate impact.
And what about the people that will say, guns don't kill people, people kill people? Mm-hmm. Because, from my point of view, this becomes a politicized issue and not a health issue. And so there's a rationalization that tends to happen around this for the folks that are listening, saying, look, if you're responsible, it won't happen.
Right. Again, I think a couple of things. One is that statement, guns don't kill people, people kill people. That's the opposite of the public health approach. It is both. A gun by itself does not kill anybody. That's true. A person without a gun isn't going to kill somebody or not as easily. So that is exactly that public health thing. We have to think about the gun and the person and the environment that they're in. And so that is a false dichotomy that I think and I think people on both sides of this issue can fall into that trap. So we don't like complexity when it comes to public policy.
Sure.
We like simple solutions. Public health approaches don't come up with simple solutions. We think about the response to COVID, which wasn't perfect, but in many ways was quite good. There were so many elements of that. It wasn't just wear a mask or just get a vaccine or just do this. It was everything all together. Same thing has to be true of this issue. We need to acknowledge the complexity. We need to acknowledge that there are no simple solutions, and we need to address it comprehensively. To your point about it being political, I do get accused of that sometimes. They say you're getting political, and my response is, if I care about kids, and I do, and I want things to be better for kids, part of my role is to advocate for policies that will help them. That's political in the small piece sense. I'm trying not to be partisan, but I don't see how you can approach a public health problem and not be political in the sense of advocating for the right policies. And so I acknowledge that it is political. I just try to make it political in the good sense and not in the negative sense.
Yeah, that's right. And there's, in the book, there's some stats that you share around accidental deaths,
right,
to firearms. And, in the hospital, I know when I go into the doctor, one of the questions they ask me is, am I safe?
Mm-hmm.
And when I hear that question, I often think about, am I in an abusive relationship?
Mm-hmm.
But am I safe could also mean, are there unlocked guns? Are there other things in the home that can harm me? Can you ask that? Do you ask that in the hospital?
It is a recommendation. A lot of what pediatricians do as part of their routine, care for kids, preventive care. We take guidance from the American Academy of Pediatrics, and it is one of the recommendations that we ask about guns in the home and safe storage practices. The uptake on that has been slow. Some states, I remember a number of years ago, Florida actually tried to make it illegal for physicians to ask about that. That fortunately was overturned. But there's still a certain reluctance to it. And, a lot of times there's a disconnect. I think physicians sometimes worry that families will feel put out, they'll feel bothered, they'll feel like you're making this political. But in fact, when you ask families, they don't mind, right? If you frame it the right way. I mean, we're not asking in a judgmental way. That's the point. It's not to ask in a judgmental way. It's in a supportive way. When you're asked if you're safe, you don't get blamed if you say you don't. You are offered help if you don't. Same thing. So I do think one of the public health approaches is to build this into preventive care to help give families the awareness and the tools that they need to keep their kids safe. And the research shows that the single most effective thing for preventing gun deaths is safe storage. Yeah. It's partly about preventing those accidental deaths. And, anytime you read about the child who finds the gun and accidentally shoots themselves or somebody, I mean, it's always heartbreaking. It's also really key in preventing suicides and homicides, because these are rarely planned things. Yeah. These are spur of the moment. And anything that you can do to put one extra step between the person who wants to harm themselves or somebody else and the ability to do it is that much more likely to break that cycle and to have them rethink what they're doing.
Yeah. I don't know if this is in Florida, was in Florida, or if this still remains true, but I remember working on this issue, and Gabby Gifford was coming here, and she was working on smart gun legislation. And I was certainly part of that initial coalition. And we were talking about just offering gun locks in doctors' offices. And I understood that there were parts of the country where it was illegal or to be able to do that. Is that true?
I don't know if there are states where it's illegal. I certainly, it is a practice that's been shown to be effective. Okay. And there are different technologies for it. So I was at a meeting a couple months ago at the White House. The White House Office on Gun Violence Prevention brought together a number of healthcare leaders. And I remember hearing a presentation from the CEO of Intermountain Health, which is based in Utah. Red, rural, large gun ownership state. And what they found was when they actually talked to people. They weren't afraid to do this. They said, hey, we want to help keep you safe. And people want to be safe. I mean, that's the other thing is nobody wants their child to get hurt by a gun. Nobody wants that. The dispute is, how do you do that? When they talk to them about the idea of gun safes, and they said, well, what keeps you from doing it? And they said, well, part of why I have a gun is for protection, and it's cumbersome to get into there if I have to fumble with a combination or a lock. But there are safes that are activated by, say, a face print or a thumbprint, which are much quicker. If I had one of those, these people said, I would use that for sure. So they started giving those out, and people started using them, which just goes to show that this isn't a partisan thing. People of all political persuasions want to be safe. They want their kids to be safe. That's often why they have a gun in the first place. I can show them data that says, well, if you have a gun for self-protection, it's much more likely to hurt your family than somebody else. I'm not going to change somebody's beliefs. If they think a gun is going to protect them, they think a gun is going to protect them. But I can help them understand how they can still have that feeling of security and keep themselves and their family safe by storing it properly. So meeting them where they are.
Yeah, you got to meet people where they are. I had a cousin who was killed by someone who shot him in 2011. And I have said his name on this podcast many times, and I do so whenever I can. Christopher Kelvin Miller, who was killed in 2011. Sorry. Yeah, very, very sad. And he was gonna be a police officer, and I started to get more and more involved after that point with gun violence. But what that triggered me, because I was sort of slumped in grief, right? So gun violence impacts everyone that person touches, and I came in contact with a project out of New Orleans that I ultimately sort of evolved into what is now Art is My Weapon, which Nikki McCombs does. That was the genesis of that, was from my cousin's death and me trying to find a way to do something to heal me and to heal others impacted. And so we brought an exhibit here, and I wanted to put it inside of a community center, pieces of it. And that was a whole thing to do that.
Sure.
And then we decided that we were going to build in a bit of a curriculum to talk to kids about guns, which we did. And they would write things down and they would share things with the team. And what was surprising to the parents who were gun owners is that the children knew where they were. They had handled them in some cases. And in one instance, there were two kids that had found and saw a gun outside at the park and had touched it and handled it and never told their parents. And I was struck by how we talked to our kids about stranger danger, watch before you cross the street. Here's what you do in case of a fire. But we haven't necessarily explicitly said, if you come across a weapon, don't touch it. And I just remember the parents being completely shocked because they thought that they were being safe.
Yeah, absolutely. And of course, then parents think, well, but they'll be able to tell the difference between a toy gun and a real gun. And the fact is, the research shows they can't. I mean, your experience has been borne out by several studies that have shown that, yes, kids, if there's a gun in the home, kids generally know how to get to it. And if they get to it, they'll play with it.
Yeah, they will. Okay, so let's switch over to the hospital just a little bit.
Yeah.
And I have a couple of questions here. One is, how does gun violence impact the hospital's operation and resources? Like, what
I would say in a few ways. First of all, when there is a gunshot victim, that's a huge response. There's an enormous team of people that descends to take care of that person. Any significant trauma does this, and it gets in the way of you being able to take care of the other patients for a while. I think the bigger impact is, and I know this from my own personal experience, it's one of the hardest things that we do as pediatric caregivers is taking care of those kind of kids. And again, for so many reasons. And part of it, to be quite honest, it's graphically gruesome. I mean, it's just what you see is you can't unsee. And it's just not supposed to be a kid problem. And, there's something really different about a kid being shot than a kid falling off a swing or getting hurt playing football. So it has a huge impact on the staff. It has a huge moral impact on the staff. And, people say, oh, you worked in a pediatric emergency room. That must be hard. I guess you get used to it. You don't ever get used to it. You learn how to deal with it. That's different from getting used to it. But I always tell people, if you don't cry after taking care of a gunshot victim, you're probably in the wrong line of work. You don't do it in the moment. You learn how to wait. You wait till you get your job done. But if you don't feel that, we all do. We all feel it.
Yeah. That was the next question I had, is the psychological impact, and what resources, or how do you, not that you forget it, but how do you take care of folks that are treating folks with level of violence coming in? What does that look like?
So we have to be intentional about that. We have, when something like that happens, whether it's a gunshot victim or any other sort of really traumatic event for the team, we do what's called a critical incident stress management, where there's a team that gets a team of support folks, social workers or psychologists, that work with the team pretty shortly afterwards to process their feelings, to process what happened, what they went through, and to help then identify who needs additional support potentially. And we have those supports available through our benefits program, but acknowledging it. I mean, and we don't wait for somebody to say, I need something. We say, you don't have to raise your hand for help. This has to have affected you. Let's all talk about it because I know it affected you.
Mm-hmm. Some of the young people's shootings and homicides in our own city have impacted me, and I haven't seen it up close and personal, but I certainly in my working community have been to more funerals than I should for children under 18. And that is some tough stuff. And it just feels like, Mark, and maybe I'm repeating, but with the level of visibility of these issues, with some of the personal reach that we've had in community, into this issue, it feels like more innovative ways of approaching this should be emerging than what we've witnessed. I mean, are there innovations that you are dealing with and partnerships that would be useful for us to understand, or ideas that you have around that?
There are. And, as is often the case, these things often bubble up from community. So there's a program that we're part of at Children's Minnesota, along with Hennepin Healthcare and North Memorial. It's called Next Step. It's a hospital-based violence intervention program. And there are others like it around the country. We had a program like this where I was in Wisconsin called Project Ujima. The idea is that when we see somebody who's a victim of violence in the emergency department, we immediately connect them with some resources. And that can take the form of peer counseling. That can take the form of family support. And the idea is both to support the family through the immediate and subsequent trauma, because this is a traumatic event for the whole family, but also to hopefully intervene in ways that will prevent that person from being victimized again. And I don't have this data for the Next Step program, but our Project Ujima program, when we compared kids that we saw in the emergency department that we enrolled in that program versus ones that same emergency department that we didn't enroll for whatever reason, we had a 90% reduction in their likelihood of being re-injured. So there's an innovative thing that comes out of community. I had a conversation recently with Melvin Carter Jr., the mayor's father, who of course is a retired St. Paul police officer, who has, for the last number of years, been involved in an organization, Saving Our Sons, working with at-risk youth to help connect them with folks a little bit older, but that they can still relate to, who can help them understand, to try to break that cycle of violence. And so there are a lot of these sorts of efforts that are going on. And I think, organizations like Children's Minnesota can identify and partner with community organizations, these ideas coming up from the people who've been affected, who can help say, hey, this is how we think we could probably address this, either prevention or again, addressing that trauma that's associated with it that you alluded to. And you're not alone. There was Kaiser Family Foundation survey, 54% of Americans personal experience with gun violence. 54% of Americans, either they themselves have been threatened or injured, a family member has been threatened or injured. That's, again, every community in the United States, this is an issue.
Yeah. In that same exhibit that I mentioned earlier that I brought to the community center, there was an artist piece there, and I believe it was called The Plague.
Mm-hmm.
And what it basically did was represented that when there is, when gun violence occurs, it impacts the victim,
Mm-hmm.
it impacts their family, it impacts all of the children that child goes to school with, goes to church with,
Mm-hmm.
into the neighborhood. It impacts the parents who they work with, right? Like the number keeps growing and growing and growing in terms of what's at play. And that really did strike me. And I certainly feel it. I feel it in my body. And this is, 2011. And I still will wake up thinking about the moments and the things that happened around it. Yeah.
Yeah. Well, you talked about Nikki McComb and the Art is My Weapon. Her most recent installation a couple months ago, I think it was called Full Circle. And It picks up on that concept because everybody you mentioned is impacted. And then there are people like me who take care of things. I talked about the impact of us. And the perpetrator is impacted, and that person's family. And that's part of what Melvin Carter Jr. is trying to do, is to help these, kids and young adults understand that through the eyes and ears of somebody who's been through it. And it really is. I mean, the impact is just huge.
Mm-hmm. Do you think that because of the level of violence that we are living through and the visibility of what that looks like, do you think it's just noise? Like, how do we move it from being noise to being present and actionable? I think that's one of the steps that you have.
Yeah. And that's a really great question, because it is so pervasive in our environment. And, if you look at TV shows or movies over the years, I mean, the levels of violence have increased to the point where it's hardly even noticeable. It's noticeable in its absence. And it really does become noise, but it has an impact. There was a study of children, where they took kids and they put them in a room. There's a gun in the room, inactivated. And one group watched a TV show that had some simulated violence, and the other watched some other TV show. And both groups of kids found the gun, to your point. Like everybody, they left the room and they said, don't touch anything. And immediately all the drawers are open and the gun was found. Yep. But the ones who had recently seen that were far more likely to point it at each other, to play with it in ways. Both groups found it, both groups picked it up, but that group was the one that used it the way a gun is. So the fact that it's out there in that environment does seem to shape behaviors in some way. And again, thinking about that public health approach, that's an environmental context that we really need to pay attention to. This is not as simple as saying, ban violent video games. I'm not saying that, but I am saying that we can't ignore, no matter what else we do, because there's one group of people that says, well, we just need to increase funding for mental health. We do need to do that. And we need to address the guns and figure out how do we make them less lethal. And we need to address the environment. You can't ignore any of those. It's complex.
Yeah. In community, you often really only hear about gun violence towards children in a homicide
Mm-hmm.
or a tragic situation.
Right.
I guess I don't really know how prevalent it is here in Minnesota or across this. Like, how many? I mean, is it nightly? I mean, one is too many, but I don't
Right.
have a sense of what that is.
Well, nationally, in 2022, that's the last year we have data for, it was almost 5,000 kids across the United States died by gun violence. About a third of those were suicide, about 40% were homicide, and the rest were unintentional. So, and Minnesota per capita is not terribly different. So it's, several hundred Minnesotan kids die each year from gun violence.
Hmm. You touched on this around mental health services, and then we were talking about the people that were impacted, and so I'm curious on how you were seeing the mental health of children that are showing up in your hospital, particularly those that have been witness to or been victim to a violent occurrence.
Yeah, certainly. In the last 10 plus years, we have seen an increase in um, mental health needs for kids, and especially for more acute mental health needs, that has accelerated in the last couple of years. So just since 2020, we've seen about a 50% increase in emergency department visits for a mental health crisis. So it's actually one of the top reasons for visit now in our emergency department. I think it's in the top 5. So overall, it's a huge issue. A percentage of those are almost certainly because of what's happening in their communities, right? To your point, when there's someone in the community is shot and killed, and keep in mind, for everyone who's shot and killed, there's a whole lot more that are shot and injured in various ways. That has an impact. I remember a couple of years ago, I was participating in it was a ride for sickle cell disease up on the north side. And it was a group of about 30 of us. We were just out on a community bike ride. And for part of the way, I was bicycling along with this young woman who was a teacher in Minneapolis public schools. And we were going past an intersection, and she pointed to the intersection and she said, "Yeah, a couple of my students saw somebody get shot there recently." And there are a couple of things about it. First is it was almost casual comment, like this is something that just happens, right? Oh, that's the corner where, that's the grocery store I go to, because it is such a common thing. But then we talked a little bit like, what impact did that have on your students? And, their schoolwork fell off. They were scared to come to school. And this is just one anecdote of exactly what you're talking about. Being a personal witness to that violence has now impacted those young girls in a way that is, I don't know how long that will last, but it certainly had an impact on them then. So some of what we're seeing, there's so many factors, but some of it I can't help but think is related to the levels of community violence that they're exposed to.
Yeah. Marc, what led you at this particular point in your life and career to write Saving Our Children, Saving Our Kids?
Well, as I said earlier, I was struck by and frankly disappointed by the disconnect between what we were doing as a healthcare community, what we were saying, and trying to spur somebody to do it. And also, I'm in a privileged position. I mean, I'm entrusted to run a health system that is, we're a nonprofit health system, we're a community asset. So I do this on behalf of the community, and I feel like we in leadership positions have a responsibility to use that in a productive way to advocate. I alluded to this, back in 1988 when I was a pediatric resident who didn't know as much as I thought I knew. I wrote a letter to the editor in the Washington Post about gun violence. I don't think anybody particularly cared what a second-year pediatric resident had to say. But but rightly or wrongly, people care what the CEO of Children's Minnesota has to say. And so I feel an obligation to use that privileged position to advocate on something that I don't see enough other people advocating about.
Yeah, so that, what I just envisioned in my head is that you have this book, you are taking it, you're using it as a vehicle to amplify and elevate the importance of the issue, that you will use it to engage partners and perhaps policy leaders on strategies. Is that sort of the hope and the plan of what?
Yeah. I mean, I would love it if all the other healthcare CEOs in the region said, yeah, we did sign that statement 2 years ago saying this is a public health crisis. Let's also start acting like it. Let's actually say publicly that we support safe storage policies. Let's publicly say that we're going to, press for this. Let's move to get the physicians in our systems to provide counseling during routine health visits about safe storage. All the different things we can do. Again, it's a multifaceted approach, but what I'm really hoping is I'll stimulate others to move from talking to action.
Yeah. How likely do you think, how big of a hurdle do you think that is?
We're making some progress. I mean, on a national level, this is gaining steam. There's a group of healthcare CEOs. It was started by the CEO of Northwell Health in New York that have been getting together to raise awareness of this issue. They're actually working with the Ad Council on a public service announcement campaign that's going to be coming out, I think, next year, that I learned a little bit more about when I was in Washington. We have a moment in time here. Every time I tell somebody that guns are the leading cause of death of kids, it doesn't fail to get their attention. Nobody expects that. Nobody expects that. And so I think we're in a moment where we can capitalize on that. And, everything we do to help kids is also going to help others. But, have a particular, you talked about, if people are responsible, then, earlier on you mentioned that if people are responsible, this wouldn't happen. But kids are kids, right? There's something unique about them that I do think we all as adults feel protective about them. And so I do think we have a unique opportunity to seize the moment and say, look, what are we going to do to save our kids? That's the name of my book, Save Our Kids. All those things are going to help everybody else as well.
Yeah, you mentioned narrative a bit in here, and education, right? Like a piece of it is just educating. If you don't know that this is the cause, it's why I wanted you on here. It's an issue that is super important to me. And I know that when I was going through my research, I didn't even realize that, in the state, it was something like statistically like 1.5 deaths by gun a day in the state of Minnesota. Well, I'm only looking at Minneapolis numbers, and most of that is street level violence.
Yeah.
But it was more prevalent than what I ever understood it to be.
Yeah.
And so my question here is, from the educational point of view, or even narrative, what role do you think media has in adjusting how they communicate about this issue?
Well, I think, I think about, so guns is often portrayed as not just partisan, but like a moral issue. On the one hand, there are well-meaning people who want to help keep people safe, who portray like people who have guns, there's something wrong with them. It's immoral to have guns. And then on the other side, there are people who think it's a sacred right. A gun is not a moral object. It's a thing. And it's a little bit like our approach over the centuries to alcohol abuse. For a long time, that was a moral failing. If you were an alcoholic, and now we see it as, no, it's a health issue. Alcohol is not a moral thing. It's a beverage and it has health effects. So I think, too often the media approach is the sensationalism. There is often a racialized spin to it, right? If we could start thinking about it as a public health problem and not as a moral failing, not as something that affects one segment of the population that the majority of the population doesn't want to think about, but as a public health issue that affects the public, the entire public.
Yeah. So we've talked about things that adults can do, right? If you are a gun owner, be responsible, lock it up, right? If the gun lock doesn't fit, like there's many options
Right.
to both lock it up and protect your family if that's your frame. We've talked a little bit about the ways that hospitals um, can approach this and care for their team and the children and their families. We talked a little bit about media. I guess my question, because I come out of philanthropy, is how should philanthropy and donors, philanthropists, be looking at supporting these issues, or do you have ideas about how they might be engaged?
It's a great question. Like a lot of public health things, there's prevention pays off, but the people paying for the prevention aren't always the ones benefiting financially from it. So, so things like, safe storage campaigns, those cost money, right? And they don't have to be terribly expensive, but helping, organizations like ours, if we want to give out gun safes, especially the biometric gun safes that we know are more popular among gun owners, helping to support those. That's one way. I think, there's still research to do. I mean, there's, for years, there was almost no funding for research on this public health problem. And, per death, if you want to look at it that way, the funding for gun violence is a small fraction of what it is for heart disease and cancer. And so we do have some evidence about what things work and what don't, but we need more research to better understand what are the educational approaches, what are the policies around guns, around people, around the environmental setting that are actually going to make a difference. So I think, thinking about how to support that work, we have some researchers at Children's Minnesota who are doing some good work on trying to understand better what works to prevent gun injury. So I'd say that's a second one. And then the third is, again, there are a lot of these ideas come from community. So I think a place like Children's Minnesota, we can be a fantastic partner. And the kind of philanthropic approach that would allow Children's Minnesota to partner with community-based organizations to come up with those solutions, I think can be very powerful.
Yeah. When you said research, I was a little surprised, but then as you talked, I think it sort of expanded the way that I think about it because, coming from the community that I do, I'm like, oh my gosh, how much more research can they do? It's a problem. Like just move and fix it.
Yeah. But I'm talking about not just, the research that we do have is defining the problem. We know the problem. Now it's defining the solutions.
Defining those solutions.
As I said, which counseling approaches are most effective? I don't know. We think counseling would be effective. Well, what's the best way to counsel patients and families when they come in? What are the best safe storage approaches? So there's still more to learn about how do we actually fix the problem. But I agree with you, more research to prove that it's a problem. We don't need that. It's a problem. Anybody in Minneapolis,
it's a problem.
Anybody can tell you that. But it's now understanding what do we do with it. And I think that we can quickly get to some things that, could actually make a difference and save people's lives.
Yeah. Do you think that the solutions, I think I know the answer to this, but as I'm processing, I often think about, violent offenders that are adults. There's a different approach to addressing what they need than there is for younger folks under 18.
Right.
It seems to me like there's a different solution for Black kids in the city versus Native kids out state or rural communities. Like, do you think that it's nuanced enough to be effective within the district?
I think you make a great point because there's, again, the public health approach would suggest that there's always a cultural element to it. We know that gun violence affects Black communities, Native American communities, white communities differently, urban communities, rural communities. Some of the approaches to solving it are going to also have to take into account that cultural context. And that's something, again, we don't know enough about, and we need to understand better so that we can actually do things that are going to save lives.
Yeah. We've talked a lot about violence and an issue that we all know. And for those listening, I imagine that if you've had personal experience, it's drudging some of that up. And I know, as I said, I sort of took my pain and tried to find ways to activate it into action. It sounds like you've done the same. As we begin to sort of close out this conversation, I would just love to talk about what is giving you hope, because
Mhm.
this is a bit of a heavy conversation, but what is giving you hope around either this issue or more broadly in children's healthcare and wellness?
Well, I think on this issue, I think, again, the fact that when I tell people that guns are the leading cause of death, they stand up and take notice. So that's the first step, right? You can't solve a problem that people don't acknowledge as a problem. We've seen some real progress. I mean, here in Minnesota, we've had some good legislative policies in the last few years that are going to make a difference. Expanding background checks, red flag laws that will allow somebody to intervene when somebody's likely to be a threat to make sure they don't have a gun handy. And then, came close with an approach to safe storage that I think we still have some hope on. So we have seen some legislative progress. That's a source of hope. And again, the fact that, people are willing to stand up and say, boy, kids should not die by gun violence. That shouldn't be in the top 10, much less number one.
Yeah.
So that attentiveness to that gives me some hope.
Yeah. I have been struck by your leadership. You could very easily be a good CEO of a hospital with your head down, looking at the team, or up to, and out in all the ways. But it seems like from, your first year, your second year, you've seen sort of the broader political and community context. Where did that come from? Like, do you have parents that were active? Like, where did that come from?
Actually, probably quite the opposite. I think it's a couple of things. First is, as an emergency physician, I mean, the emergency department is sort of the center of a lot of things, and you really do get to see the big picture in that role. A lot of medical specialties, it is easy to, have your head down and focus on your one thing, but we are forced to look very broadly. And so I think part of it is that. But also, I didn't mean, when I was starting out, I did not aspire to this job. I can assure you. My motivation has always been because I wanted to have more of an impact. I had a great impact on families that I took care of in the emergency department, one at a time. As a leader, I can impact a lot more people. And so I've always wanted to do this because of my desire to help more people. And that includes not just the people who, the 160,000 kids a year that we see in our health system, but maybe all of the hundreds of thousands of kids in the state, if I can play that role, not just leading my system, but using my expertise and my voice to raise awareness and to advocate and to champion the health needs of kids.
Mm-hmm. If you were speaking from a legacy point of view, do you see that as part of your legacy is the influence and impact that you've had over wellness of children and family?
I hope so. I sure hope so. It's and that I don't think it's going to come in the form of anything named after me or anything like that. But if I can motivate some more people to want to do something about this particular issue and we get some things done, it's a pretty cool legacy, I think.
Yeah, I think so. If folks were interested in reading your book, where would they find it?
It is on Amazon. It's called Saving Our Kids, or it's savingourkidsbook.com is the website. Book's available there. All proceeds from the book go to support our violence prevention programs here at Children's Minnesota. So you not only hopefully get some information, but you'll also be helping us do some of the good work that we do here.
Awesome. Any shout outs that you want to do with folks that maybe helped you along that book writing journey?
So many people. I think, one of my mentors in gun violence is Dr. Steve Hargarten. He was one of my mentors in Wisconsin, well known in gun violence circles. Dr. Andrew Karagu, who's one of our intensive care doctors here, who's a very passionate advocate as well. And certainly the folks on our communications team who help came up with the crazy idea of doing it in the first place and then helped me turn it into a reality.
Very awesome, Marc. Thank you so much for being on the podcast. Thank you so much for your leadership and your influence and for staying consistent. It feels like this has to have been just a consistent theme throughout your career. And, I am becoming more and more aware of how one person can change the course on a path that feels like it's already written. We see examples of it every single day where new energy is infused, that new policy moves forward, that new opportunities happen. And in this case, on this issue, it in fact does save lives.
Exactly. Well, thank you for that. And thank you for the opportunity to be here. It's always great to talk with you. And this is something I care so much about. So I'll take any opportunity I can to help raise awareness of it. Thank you for helping me.
Sounds good. Thank you. I hope you have a wonderful day.
Thank you.